Hello, ladies. My name's Angela from Angela Simpson Functional Medicine. And I want to talk to you today about a topic that I find is something that needs to be addressed because often when we suffer from symptoms of hormone imbalance, and we've tried several different things to try and get the balance back, we've tried all of the basics with lifestyle. We may have even gone beyond that, tried doing lab testing, might be lab testing from your family doctor, some of the basics might be beyond that, might even be some specialized lab testing that you have had either from a medical specialist, holistic practitioner, or functional practitioner. And you may still not feel like you've gotten the answers and you've not gotten the solution to your symptoms and your issues, despite maybe trying one, more, or all of these things. And if this is the case, I do want to speak to you. And I want to let you know that it doesn't mean that there isn't a solution to what's going on in your body to get your body back on track and get you feeling like yourself again. It just means that you haven't found it yet. And so you might need to do some more digging. And so I want to bring to you some of what I have seen over my experience from working with women suffering with hormone imbalances over the years, for women just like you that feel like no matter what they've tried, nothing has worked. And I was one of those people too. It took me years and years to figure out where my hormone imbalances were coming from. And luckily, I started to work with a practitioner that was able to really pull back the veil and dig in and figure out where things were really coming from. And once I learned that, I was able to get better fairly quickly. And what I mean by fairly quickly for me personally is it took about 5 months for me to start to feel better enough that I was feeling more functional. And it took me another 3 months after that to feel like I was starting to get my life back and I could see the light at the end of the tunnel. And so, this timeline is going to be different for everyone. Depends on what's going on in your body, depends on how many systems are affected in your body and how severely. But I want to let you know, and I want to give you some hope in that there is an answer. It's just you probably haven't found it yet if you've tried several things and you haven't gotten the result that you need. So, what are some of these common hidden causes of hormone imbalance symptoms? And again, these hormone imbalance symptoms, they can be chronic fatigue, chronic pain, can be pain associated with cycles, can be things like cramping, can be well beyond that. And you might have joint pain, muscle pain that's there not only with the timing of your cycles, if you're still cycling as a female, could be something that's there more all the time. Could be brain fog, memory issues, could be changes to your weight loss resistance. Could be if you are having cycles that your periods are either erratic or heavy, unmanageable. Could be your moods have become more off the wall. You might be sad, angry, and irritable one minute and happy the next. And so, if you're having these things happening on a regular basis, there's no doubt it's affecting your life, your ability to work, your ability to associate with others around you, especially your close loved ones. I'm sure it's affecting your relationships with them. And so I know you want an answer. And so I want to let you know that what I've seen is quite commonly, a lot of these symptoms are coming from our immune system. And there can be several different things that are causing our immune system to react. And when our immune system is reacting, it's not responding in a normal manner. It really affects the way our hormones are processed. And the reason for this is because a lot of the hormone processing does actually happen in the gut, and 80% or more of our immune system is in the gut. And so, if you haven't had this discovered through either specialized lab testing or learning on your own from either working with practitioners or discovering some of this information online, I want to let you know that there is a way to learn about this for you. And depending on what's going on with your body, it could be something such as a bacterial infection in your gut, a viral infection in your gut or in your body somewhere that hasn't been discovered yet. Could be something like Epstein-Barr virus, which is so common. So many of us have had it. We may or may not know that we've had it if you've had mono and it was obvious and you were really ill at some point. Often that happens earlier in life versus later. There's quite a possibility that there is still some viral load in your body that could be affecting your immune health and affecting your hormone health. That's one example. There's more. Is there the potential that you have had Lyme exposure at some point in your life? And again, you may or may not know it. It's not that you have to necessarily get severely ill to actually have the infection of Lyme. Definitely a lot of people do, but not always. As well, it's not uncommon to have a bacterial imbalance in your gut where you have more unfavorable bacteria than favorable bacteria. And so, again, this really affects your hormone processing. This can happen from several different things. Using antibiotics at some point in your life, it can even be just one or two times that upsets the balance there. A lot of women have used antibiotics several times in their life, on and off, for a period of time, and then they've come off of them. Have you had, any sort of sickness or illness when you've traveled? Did it kind of just go away on its own, or did you need treatment? This can upset the balance of bacteria in your gut as well. So just because those acute symptoms go away doesn't necessarily mean that the balance has come back inside your gut, again, which is where most of your immune system is housed. Do you notice that you're getting more sensitive to certain foods? Some people are aware of when foods trigger symptoms for them, and some people are not. So these reactions can actually be very subtle, occurring inside the body and not feeling them externally. But again, often you can notice them externally depending on how much reaction is happening in your immune system and for how long it's been happening. So there's all these different potentials of things that could be happening in your body. And all of these things, again, when they have to do with the immune system, if the immune system's out of balance, it's not functioning correctly, it's going to affect your hormone balance. There's just no way that it can't, because when our hormones are produced in our body, they have to be shuttled, processed, broken down. Some of them need to be eliminated. So a lot of all of these processes happen via the gut. And again, that's where our immune system is housed primarily. So if the gut's off, our hormones are going to be off. So I want to make sure that if you haven't discovered this yet, if you haven't gone through and figured out the process of where your symptoms are coming from, and you've been doing things to try and treat and manage without getting better, that there is a way to dig deeper to learn what's going on in your body. It can be some things that are talked about on a history. If I work with you, I always go through a very detailed history all the way back to when you were a child, so I can figure out where things could be coming from in the first place, all the potential triggers for your symptoms, even if you feel like they might have happened more recently. Quite commonly, what I find for women is once I start speaking with you, a lot of these symptoms actually have come up gradually over time from various different things that have happened in your lifetime. So it's really important to take a good history. And then beyond that, once there is that discovery of where it could be coming from, where it could be coming from your symptoms, it's really important to verify that with the proper lab testing. And so there is ways to do that. There's various different types of lab testing, and there's lab testing that can be customized to what the needs are for your body. And so this is really the formula for success, as well as putting a plan in place. It's going to be something that you can follow and you can be well supported with. And so this is how I work with women. And so I hope that I'm able to give you some information here that's going to help you decide if it would be useful for you to have an initial call with me, so that we could look at a way to help get you a solution to your health. So if you want to reach out, please let me know. You can contact me at my website, www.angelasimpsonfunctionalmedicine.ca, and you can book a call. There's a free complimentary consult available there on the website link. And I really look forward to speaking with you soon. Take care.